ladies and gentlemen. One of the most common cases we come across in clinical skills exam is fever. Fever can be temperatures anywhere from 99 to 103, and this case is a very important case because your history and physical examination skills come to be challenged. Now, history is the key. How you ask the patient, what you ask the patient determines how you are going to treat this patient. Whether you are going to treat inpatient, outpatient, what medications you are going to use, especially from clinical skills point of view, is the patient needs some referrals or tests. Those are the important things. Now, ask the patient, how long do you have the fever? If it is an acute fever, there are some acute causes. If it is a long-term fever, there are long-term causes. And review of systems is very important. Is the patient, do you have sore throat? Do you have headaches, muscle aches? That's probably cold or flu. Do you have lymphadenopathy? Did you recently kiss somebody? Those are the questions you need to ask when you think of infectious mononucleosis, those kind of things. And this is also important because in terms of prevention, sometimes you have to also you should ask, do you have any nausea, vomiting, diarrhea? People with gastroenteritis presents with fever and gastrointestinal symptoms. Commonly people say, I got stomach bug, stomach flu. So fever, in addition to these problems, and these patients, you should counsel them to avoid dehydration, to eat less amount of food and increase water, those kinds of things. So you see how the case progresses. Also ask, do you have shortness of breath? That's important in patients like who are having pneumonia or pulmonary embolus, fever plus shortness of breath. And are you coughing up any yellowish sputum? Bronchitis. So very important to ask ROS in these patients. And if you see these infections, it's important to write blood cultures in your labs. Okay, sir, did you lose your weight recently? And do you have night sweats? Those are important in people who look malnourished. They may be having tuberculosis or AIDS. And so that's important. If you need to do PPD test and HIV test, those are the things you need to write in your patient note. Also, do you have any strep throat with is it feeling like sore throat, and do you have any kind of rash on your body? Those questions are important. Sometimes streptococcal pharyngitis causes fever. So sometimes even rashes. Do you have any rash? Did you get any rash anywhere in your body? Because many infectious diseases, they cause rash plus fever. So always ask ROS, a clear-cut ROS. And do you have any diarrhea, any blood in the diarrhea? Those kinds, because conditions like appendicitis, diverticulitis, they come with abdominal pain. So ask about abdominal pain, because appendicitis comes with fever and abdominal pain. Do you have any skin discoloration like red streaks on your legs? You could ask, because cellulitis, lymphangitis, they come with fever plus rash, commonly in legs. This question is very important, especially in diabetes, because diabetes patients are run high risk for these cellulitis in legs and extremities, and they might come with fever and cellulitis. And also, especially in children, you should ask about, does your ears hurt? The otitis media, middle ear infections, otitis externa, they cause fever. So do you have any earache? Ask about it. And for people with acutely high fevers like 103, ask about, did you go out in extreme hot weather? Because some of these patients, they develop heat exhaustion or heat stroke. And the other thing is, when you ask about medications, ask about, have you been started on any new medication recently? Because many new medications, they can cause fever, they can raise the temperature. So you can ask about new medications under medications section. And as I said, pneumonia is one of the most common causes of fever in the elderly. So you should ask about pneumonia symptoms like cough and yellowish expectoration and shortness of breath, those kinds of things. And also in women, especially older women, you should always think about urinary tract infection. So in these patients, ask now, does it hurt when you pee? How many times are you going to bathroom to pee? So pee is they understand pee more than they understand urinate. So always ask about, always think about urinary tract infections in older female patients. And also ask about neck stiffness. Are you feeling any severe headache and neck stiffness? Because conditions like meningitis and encephalitis, they present with neck stiffness, and there's a medical emergency right there. So you see how you ask these questions determine where you are going to treat patient, how you are going to treat patient. Are you going to treat right away? Are you going to send these patients right away for a CSF tap? So these are all important things you need to think about. You say fever is such a divergent, for that matter, any symptoms people come with, they have these divergent causes. So we need to think about all of them. So think about differential diagnosis even before you enter into the room, and that helps a lot. Thank you very much, and read USMLE Smasher for all the small tips you need to pass this exam. Thank you.